Respiration is controlled by a negative feedback mechanism, and the objective of this negative feedback mechanism is to maintain normal blood gas levels, maintaining normal partial pressure of oxygen and a partial pressure of carbon dioxide. This negative feedback mechanism, like all other negative feedback mechanisms, will have three major components. Sensory receptors, which are going to monitor different variables, each sensory receptor specific as to the type of variable it will monitor. When that variable moves away from its normal range, a stimulus causes the sensory receptors to send information to a control center, which in this case is going to be the brain. The pathway that sends the sensory information from the receptor to the control center is called the afferent pathway. Once the control center determines what needs to be done to maintain homeostasis, it will send that information by way of the efferent pathway to the effectors, which are your respiratory muscles. Let's look more deeply into this negative feedback mechanism. We'll start with the sensory receptors. Chemoreceptors, as their name implies, will be monitoring different chemicals in the blood. Chemoreceptors located in the brainstem are referred to as central chemoreceptors. They will be monitoring hydrogen ion concentrations in the brain fluid, and these hydrogen ions come directly from carbon dioxide. As carbon dioxide levels increase in the blood, the carbon dioxide will diffuse into the brain. Once in the brain, that carbon dioxide will react with water to produce hydrogen ions and bicarbonate ions. So actually, an increase in carbon dioxide will lead to an increase in hydrogen ions. However, it's the hydrogen ions that will stimulate the central chemoreceptors, not the carbon dioxide. Another location where you find chemoreceptors is in the peripheral arteries. You have a collection of chemoreceptors in the aortic arch, and they are called the aortic bodies. You also have a collection in the carotid artery, where the common carotid feeds into the internal carotid, which takes blood to the brain. These are called the peripheral chemoreceptors, and they are monitoring the levels of oxygen, carbon dioxide, and hydrogen ion concentration in the blood. So let's recap this. Chemoreceptors monitor blood chemicals. They are monitoring specifically oxygen levels, carbon dioxide levels, as well as hydrogen ion levels. But remember, central chemoreceptors are only stimulated by hydrogen ion levels that come directly from carbon dioxide, whereas the aortic and the carotid bodies, the peripheral chemoreceptors, are monitoring the partial pressure of oxygen, the partial pressure of carbon dioxide, as well as hydrogen ion. We're going to begin with carbon dioxide. Carbon dioxide is the main regulatory chemical for respiration. In other words, during expiration, it is carbon dioxide that you are eliminating from the body. Remember, carbon dioxide levels are directly related to pH. As you increase carbon dioxide levels in your blood, your hydrogen ion concentration increases, which will decrease your pH. Ventilation rate regulates hydrogen ion concentrations in your brain. Remember that carbon dioxide diffuses into the brain. Once it comes in contact with water, it is converted to bicarbonate ions and hydrogen ions. And it is the hydrogen ions that stimulates the central chemoreceptors. Hence, ventilation rate regulates hydrogen ion concentration in the brain, even though it is carbon dioxide that is the main chemical that you are eliminating from the body through expiration. Elevated carbon dioxide levels in your body fluids is called hypercapnia. Hypocapnia is when your carbon dioxide levels are below normal. What happens to your breathing rate during conditions of hypercapnia? If you have elevated levels of carbon dioxide in your blood, you will want to remove or eliminate the carbon dioxide at a greater rate, so your respiratory rate will go up. Let's recap this. Ventilation is regulated to mainly control the levels of hydrogen ion concentrations. If a patient is hyperventilating, their respiratory rate has increased above normal. So what do you think will happen to the partial pressure of carbon dioxide in your arteries? It will decrease, which will lead to hypocapnia. Hypocapnia causes the blood vessels in your brain to constrict, so vasoconstriction of cerebral blood vessels occurs. And this will decrease brain perfusion. Remember, perfusion is blood flow to a particular tissue, so in this case we have a decrease in brain perfusion. With a decrease in blood flow to the brain, you will have low levels of oxygen reaching the brain, and this will lead to cerebral ischemia. As a result of this ischemia, you will begin to feel dizzy or may faint. During times of decreased carbon dioxide, you end up decreasing your respiratory rate to allow the carbon dioxide levels to build up in concentration. This can lead to periods of apnea or periods where you are not breathing. A second type of chemical that stimulates the chemoreceptors is oxygen. Oxygen is primarily transported bound to the hemoglobin, and therefore only a small amount is dissolved in the plasma, only 1.5%. It is this amount that is being monitored by the chemoreceptors. Arterial partial pressure of oxygen is about 100 millimeters of mercury, and the partial pressure of oxygen has to drop down to 60 millimeters of mercury before the chemoreceptors are stimulated. So why is that so? It's because most of the oxygen is being transported to the cell bound to the hemoglobin, and a drop in the plasma partial pressure of oxygen is not going to have a significant impact on the transport of oxygen to the cells. It is the oxygen dissolved in the plasma that is being monitored by the chemoreceptors. Hydrogen ions are the third chemicals that are being monitored by your chemoreceptors. Remember, there's a relationship between hydrogen ions and pH. pH is the measurement of the hydrogen ions. As the concentration of the hydrogen ions goes up in a solution, the pH begins to drop and become more acidic. pH influences ventilation even if the partial pressure of oxygen and carbon dioxide are normal. Why is this so? It's because you can have a drop in pH due to your metabolism. You produce metabolic acids during your metabolism, and as they accumulate, they can drop your pH. It is the peripheral chemoreceptors that will be stimulated by metabolic acids. This is because only hydrogen ions that come from carbon dioxide stimulate the central chemoreceptors. So even though the partial pressure of carbon dioxide may be normal and the central chemoreceptors are not being stimulated, you can still stimulate the peripheral chemoreceptors when you have an increase in metabolic acids. Let's look at a second type of sensory receptor, and these are called stretch receptors, which are located in the lungs. These receptors send information to the central control center by way of the vagal nerves, and they initiate what's called an inflation reflex. This reflex is meant to protect the lungs and prevent them from overinflating. When the lungs begin to inflate too much, the inspiratory muscles relax. Expiration occurs. Another group of receptors are irritant receptors. Irritant receptors pick up certain chemicals, and they send the information by way of vagal nerves. These chemicals that function as irritants can cause the smooth muscles in the bronchi to constrict, bringing about bronchial constriction, which can cause coughing. This coughing then can remove an irritant from the airways. The second part of the feedback mechanism involves the control centers. The main control centers are located in the brainstem. The brainstem consists of the medulla oblongata in the pons. We'll begin by looking at the medulla. The medulla's job is to control the rate, how fast you breathe, and the depth. There are two groups of neurons, the ventral respiratory group and the dorsal respiratory group. The ventral respiratory group sets the rhythm of your breathing, how fast you're breathing, and how deep you're breathing. And it consists of two groups of neurons: inspiratory neurons, which are going to stimulate inspiration, and expiratory neurons that will inhibit inspiration and bring about expiration. The muscles involved are the diaphragm and the external intercostals. The phrenic nerves innervate the diaphragm, and the intercostal nerves innervate the external intercostals. During inspiration, these nerves are firing and the muscles are contracting. During expiration, they are not firing and the muscles relax. Eupnea is normal respiration, and that consists of having between 12 to 16 breaths per minute. When you have an elevated respiratory rate, that is called hyperpnea. The dorsal respiratory group, located within the medulla, has a different job. It receives sensory information from sensory receptors, and it uses that information to modify your rhythm, to increase your respiratory rate, decrease it, and also to influence the depth of your breathing. Highlighted here, you'll see some of the information that is being sent to the dorsal respiratory group. This is sensory information that we have talked about already, with the exception of just a few. In the pons, you have another group called the pontine respiratory group, and this group sends information to the ventral respiratory group to smooth out your respiratory rate. This group modifies your rhythm during certain activities such as vocalization, sleep, and exercise. Additional respiratory centers are found within higher brain areas, such as the cortex. You can voluntarily hold your breath up to a point, and this is called volition. In addition, emotions and other conditions can influence your respiratory rate, and this is done through the hypothalamus limbic system. When you're cold, when you touch something cold, you gasp. When you're excited, your respiratory rate will increase. When you're angry, you hold your breath. Lastly, know this equation. We've been talking about this equation throughout this chapter. You have to know that carbon dioxide reacts with water, and the enzyme for this reaction is carbonic anhydrase. When those two molecules react with one another, they form carbonic acid, which then breaks apart or dissociates into hydrogen ions and bicarbonate ions.